So I just want to welcome everyone to our presentation today about the flooding in eastern Kentucky that happened in July of 2022. Next slide, please, Lynn. So I want to welcome everyone today. There are 12 states represented on this webinar today, along with the District of Columbia. My name is Tracy Pate. I'm an emergency preparedness specialist with iPro. I'm joined by my colleague, Katie Halata, who is also an emergency preparedness specialist. And Katie works on the Alliant Health Solutions contract. And we're going to hear more about Alliant in just a second. And I want to thank everyone from ARH who has taken the time to join us today to share your remarkable story about what your community went through in July of 2022. We're glad to have all of you here to share your experience and your lessons learned with the group. Before we start, I also want to thank everyone that helped put this presentation together. Much like preparing for and responding to emergencies, these things don't happen in a vacuum, and it's never just one person. It takes a team. For getting us to where we are this morning. Next slide, please. Oh, I did that too fast, Lynn. I had a little more, but you can leave it here. It's fine. Just some housekeeping items. Today's session is being recorded. The presentation format is a little different today. We're going to do a few slides, and then we're going to switch over to a video that tells the story of the flooding, and then we're going to come back and our speakers will answer questions live for you. You are all on mute. You will not be able to unmute yourselves except for the panelists, and any questions that you have, you're going to enter into the chat. And then at the end of the presentation, Katie's going to cover how you get your CEUs that Alliant very graciously helped coordinate and provide for everyone on the webinar today. Okay, so now we're on this slide. So if you're not familiar with who we are, iPro is QIN-QIO that holds federally funded Medicare contract in the regions highlighted on this slide. iPro specifically covers New York, New Jersey, and Ohio, while our partners at Health Centric Advisors help support Connecticut, Maine, Massachusetts, New Hampshire, Rhode Island, and Vermont. And then our partners at Clarent help support Maryland, Delaware, and the District of Columbia. And together, those three organizations make up the iPro QIO. Next slide, please. And our co-host for today is Alliant Health Solutions, and they are a QIN-QIO that covers the regions highlighted on this version of the map. And that's Alabama, Florida, Georgia, Kentucky, Louisiana, North Carolina, and Tennessee. And as I mentioned before, Alliant Health Solutions was gracious enough to coordinate, sponsor, and provide the CEUs that are available for attending today's session. And we have a slide on how you'll get that certificate and those CEUs at the end of the presentation. Next slide. Our learning objectives for today are to understand the impact of geography, culture, and socio-economic status on incident response and community resilience. We're going to recognize the value of leveraging relationships and innovative approaches to incident management. We're going to identify strategies for collaborating with community partners through an extended recovery period. We're going to hear a lot about that today. So next slide. So this is a map of Kentucky. The top map is the National Weather Service map for the days that we're going to talk about in the presentation. And then if you look where the darkest, reddest areas are also the very same region that our speakers' healthcare facilities are in. So just a little geographical context there. So the Appalachian Mountains of eastern Kentucky and West Virginia have long been home to thousands of the nation's hardworking coal miners These same mountains, which the coal comes from, offer shelter, security, a home to generations of families. But some of those same mountains that offer a sense of safety to its residents have historically also served as barriers for access to health care. Not to mention some safety risks, obviously, with the mountains, rivers, streams, creeks that are all over the region. So it was with that that need of access to healthcare and the risks of the geography that in the mid-1950s, the United Mine Workers of America committed to establishing 10 hospitals in the heart of Appalachian coal mining territory. And that started as Miners Memorial Hospital, and it is now known as Appalachian Regional Healthcare. So known in the community as ARH, and how I will say it from now on, because the full name is a bit of a mouthful. But ARH has been a part of this community for the last 6 decades. It operates 14 hospitals in Eastern Kentucky and West Virginia. It provides care to more than 500,000 people throughout a 24-county region. Communities ARH served are not confined to the 4 walls of hospitals, clinics, pharmacies, or buildings that they operate. It's a team of therapists, nurses, doctors, and even CEOs that are out in the communities each and every day, participating, educating, and supporting their community. Never has that support been more apparent than in the wake of the July 2022 flooding that devastated much of the Eastern Kentucky region. Before the deadly water had receded, ARH helped more than 20,000 individuals. These are the statistics on this response, folks, and they're pretty big numbers. So 20,000 individuals, 550,000 households, 6.5 million pounds, and that's 3,250 tons of supplies to the community. And the ARH Foundation has been able to raise more than $2 million and disperse more than $1.2 million directly to those impacted by the floods. So not an easy task, and really a remarkable story. Next slide. So this is just to put the weather of the day in context. Floods are nothing new to Kentucky. In looking at the National Weather Service website, you've got quite a history of flooding in Kentucky, and there's a lot of historic floods. There's 1937, 1945, 1957 was specifically highlighted, 1978, 1997, 2010, but 2022 was a totally different story. In the emergency preparedness, emergency management world, we often talk about the 100-year flood, the 500-year flood. The National Weather Service called this a 5,000-year flood. So certainly something no one had ever dealt with before. So between July 25th and July 30th, that's our timeline of events that results in what you guys are going to see in the upcoming video and that our speakers are going to talk about. There was a complex of what they call training thunderstorms that brought heavy rain, flash flooding, and river flooding, which of course doesn't stop at the river, it goes to the creeks and the streams in the community. But rainfall was coming down at a rate of 4 inches per hour. And while it wasn't constant over the 4 days, it was so much rain that it actually broke the gauge on the North Fork River, which the previous rainfall record was 14.7 since they'd start measuring, and that was the 1957 flood that was highlighted earlier. And Katie's going to put those links in the chat so you can read more about the impact some of the other floods had. So you have a comparison to what happened in 2022. But the biggest flood was actually in before measurements, so I'm not sure how they came up with this number, was actually in 1939. So that record was 43.1, and the flood event of 2022, its final measurement was 43.47. So that's where we get that 5,000 year flood event. So in the process of the response, and the video will touch on this just a little bit, but I want just more stats by the numbers. 600 helicopter rescues in this region. There were too many swiftwater rescues to count. And obviously the geography of the region posed some challenges for emergency medical services. And the video is going to go into a little bit of that too. So that being said, Lynn, this is where we bring up the video. It's the best part of the story. We have this short video. It's about 22 minutes long. And then when we're finished with the video, we're going to come back to the ARH team and the discussion and the question and answer session. So Lynn, you can go ahead and start the video up.
Last Wednesday, 12 o'clock, went to bed. 1:30, we were woken up with floodwaters over our front porch. So, put life jackets on the kids and wife, and watched our whole house, our cars, everything, just get enveloped with water.
We woke up to the sound of the garage door opening. It was my mom. We thought it was a good idea for me to go move my car. But by the time I went and got my shoes and a raincoat on and got to the porch, the water had already came to the driveway and within minutes picked my SUV up and it started floating down the road.
My emergency alerts went off through the night, and so I went into the hospital early that morning expecting to have a busy day. When I got there, the information about the floods was actually just coming out, and I don't think people realized the devastation until the sun came up.
The morning after the storms, Holly came in and she asked us if we'd heard about the storms, and we started talking about it, and we realized, the magnitude and the extent.
When I think about what happened with the flooding, it really started as a story of complete disaster and chaos in those early hours and early days that we all came together and really realized the magnitude of what happened. And through that, we were able to really see the resiliency of our people come together and do whatever was needed to do to help one another.
My first thought was our employees. Were they safe? Our next thought was to identify our high-risk patients.
The need was overwhelming. The response was better than could have been anticipated.
ARH started sending in tractors and trailers full of supplies that was needed for water, food, clothing, but then we started working on the long-term plan.
Our work is far from done. We are now working with the long-term recovery teams and their unmet needs committees to make sure that those who are most in need get the support. We are daily doing things with our local long-term recovery teams, like purchasing lumber, pouring footers, providing heat and air systems. The list goes on, as do the needs. Unfortunately, there are still hundreds of families who still need our support. It's for this reason that we continue to ask for your support. We are here to help.
Are you?
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 My name is Paul Buda. I'm the Assistant Vice President of Security Operations for Appalachian Regional Healthcare. I spent my the majority of my adult career in public service, formerly with the United States Secret Service as a special agent and as a Marine Corps officer in the United States Marine Corps. My responsibilities during our relief efforts was I was assigned as the team leader for our Incident Command Center. My responsibilities were to coordinate the relief efforts between the logistic support, the logistic train that was being pushed out, and act as an intermediary between the non-governmental organizations, governmental organizations, and manage the inflow of information so that our communication strategy could be executed so that we could continue the relief efforts. Immediately after the storms, we recognized that this was something more significant than our initial impression. We didn't have good communication with our hospitals. We didn't have good communication with a lot of our employees. And we realized that the infrastructure to support our hospitals had been damaged severely. We quickly put together a team that was going to respond to the incident itself. Within a few hours, we had decided that we were going to have the command center be at the Lexington corporate office. There's no loading dock. There's no warehouse. It is strictly a corporate office. We recognized that we needed to think differently. We took down cubicles and made a warehouse area. We cataloged and organized equipment inside that area. And then we started to figure out how to facilitate a logistics supply train that would meet the needs of everybody in Eastern Kentucky. And our initial impression was we wanted to help our employees, and we soon realized that this was beyond the scope of our employees. It was an area that we had a hard time grasping it initially. When you talk thousands of square miles or tens and thousands of square acres, you really can't put that into perspective. And we decided that we needed something that everybody could grasp easily. When we looked at the square mileage and square acreage, it came up to be an area the size of the state of Rhode Island. And we knew that we couldn't just focus on our employees. We had to focus on that entire area because now we're helping Eastern Kentucky. Appalachian Regional Healthcare has been in Eastern Kentucky since 1956. We've been helping the people of Eastern Kentucky for the last 65 years. We weren't going to let them down this time. For about the first month, it was 16-hour days, 7 days a week. It didn't matter who you were, from the CEO to administrative staff. Everybody had a job to do, and it didn't matter what that job was. There were times where numerous 56-foot-long trucks would come into the parking lot, and you would see the admin staff, the CEO, the CFO, the COO on the back of trucks for hours unloading trucks so that we could catalog and organize all the relief supplies that were coming in so that they could then be reloaded onto trucks that were being pushed to Eastern Kentucky. In total, in that time period, we pushed about 6.5 million tons of relief supplies to Eastern Kentucky. We had a robust internal logistics supply train that we were able to optimize. We did this by taking everything that was consolidated in Lexington and then pushing it out to our regional medical centers. The regional medical centers would then take those supplies, break them down, push those out to the critical access hospitals. The critical access hospitals would then begin the distribution process and even push those supplies further to our clinics that are out in the rural communities. And so we were able then to support the medical capabilities we were pushing out into the community. We were able to support the immediate needs that were required in the community. And then we were able to partner with other organizations because as we're pushing our efforts out, we're gathering information in, and that information was critical to everybody else. What was really unique was we were able to get the ground truth on a daily basis of the needs and the areas that were hardest hit and required the most attention.
My name's Todd White, and I work for the Security Operations Center at ARH. Prior to that, I spent the last 30 years in law enforcement. Once I retired, I came on with ARH, and kind of a smooth transition because I was already covering the Eastern District of Kentucky, and now I was thrust right back into Eastern Kentucky, so it kind of felt like home again. So when we were in the rescue phase of this, we were supplying essential needs to the victims. They had nothing, so we were supplying cleaning supplies, shovels, camp stoves, toiletries, anything that they would need to survive on a day-to-day basis. So we created the DRC, the Disaster Relief Center, to be a hand up for the community, not a handout to them. We wanted a space where these people could come and do a one-stop shop and get the items that they needed to survive. But during that transition in November, we kind of renamed it to the RDC, the Regional Distribution Center, where we would supply the people. Instead of them having to come to us, we went to them. We would load up the showers, the cabinets, the bathtubs, the washers, the dryers, and we push that out to the victims in their homes once we confirmed that they did need those items in their homes. And we realized that we had a gap at that point that we weren't quite prepared for, and we started partnering with some other organizations, CORE, EKSEP, Go Higher, a lot of governmental organizations and non-governmental organizations like FEMA, Red Cross, and one organization that we worked with who I don't think we could have pulled off what we did without them was Good 360. We've gotten so many donations from them that it's just been incredible for the victims. And we started getting donations that were bathtubs and showers and cabinets and beds and bed frames, because once that rescue phase was over and we started rebuilding, we would have a victim walk into a new home with nothing in it. So we had to be prepared for that.
My name is Dr. Scott Harrison. I serve as the Regional Chief Medical Officer for Appalachian Regional Healthcare in the Kentucky River region, including Hazard, Whitesburg, and Mary Breckinridge ARH hospitals. I remember getting the call about the floods the day after the heaviest portion of the rain. I was told, there was some devastation, but you can't really understand just by hearing about it. I saw pieces on the news. Information started to come in about how many people were affected, the areas affected. The water was too high to access it. I later read that there were over 600 helicopter rescues, countless swift water rescues. A couple of days later, I was able to get in the area, and that's when the visual effects hit me. It was beyond what I had expected. It lets you know real quick that this was going to be a long process. I checked in with my ER teams, got on site to Hazard first, was talking with their ER team there, was kind of surveying what was coming in initially. The first couple of days, ERs were impacted by the rescues, obviously. Mostly seeing traumatic injuries from debris floating or people caught in the rapids, lacerations, broken extremities. It filled up pretty quickly in the emergency department. People had lost their entire home. Even if they were able to be treated and discharged, there was no place to go. So disposition became a problem. So immediately it was more of a trauma first aid type scenario. Later we would run into the longer term effects of healthcare without their medications, but kind of seeing just the look of shock on patients' faces, what they had just witnessed and been through, was overwhelming, and it humbled you very quickly. So initially we were on the phone trying to coordinate responses. It took a couple days to finally have a safe access to the area. Water had started to recede a little bit. We wanted to get our ground game going to kind of survey the area to see what we could do from the medical perspective. Teams of EMS, nursing, physicians, we gathered with ATVs, went out into some of the areas that were no longer accessible by car easily. Roads had been partially washed away. Bridges collapsed over the creeks. That was the only access to the home. So people were stranded in their area. People were out on foot going door to door. Initially with the ATVs, we wanted to kind of just survey what we could. We carried some basic medical supplies, a lot of water, the tetanus vaccine updates. Overall, I think we administered about 300 doses of tetanus vaccine. And I don't know how much water we gave out. We were loaded down with multiple runs. Our home health agencies were out on foot, door to door. I think we have about 300 people with our home health. And when you think about it, I think there was anywhere from 700 to 1,000 patients on oxygen. And without their power for concentrators, our home health teams were scrambling with their vendors to try to make sure we had enough portable tanks for people requiring oxygen. Personally, I remember seeing several injuries, extremity issues, sprains, strains, but 3-year-old little girl had been walking around on about a 2-inch laceration on her foot for several days. It had become infected. And, those are the heartbreaking ones because there was nowhere for them to go. Couldn't get away from their residence. Their bridge had been washed away. So we had found a way to get across. I offered to take her to the emergency department. They refused, but we dressed the wound as best we could, got in touch with some resources to help them out. But those are the scenes that when you leave that area, that stays with you, just the traumatic injury. Next couple days, we continued to kind of strategize. I was involved in some of the meetings being held on a daily strategy call, securing all the proper equipment. Donations were pouring in. Any spare time we had, we were unloading trucks for supplies. But it's been very, very humbling to see the response from Appalachian Regional Healthcare and the community in general with the health departments and the business, how much giving and time went into this. And from an operations standpoint, it's like nothing I've ever seen before.
Hi, my name is Whitney Allen, and I'm the ARH Foundation Coordinator. Primarily, I handle the marketing and communications duties within the foundation, but I also assist with the annual fund, and I help to plan events and outreach for the organization. The ARH Foundation for Healthier Communities has a mission to further healthcare, education, and community involvement in Eastern Kentucky and Southern West Virginia. Just prior to the floods, we were under new leadership with Executive Director Angela Bailey. And as you can imagine, as anyone coming into a new position, she had goals in mind and she had things that she hoped to accomplish. But she accepted the position just 2 days prior to the flood. So quickly, those goals and those things that she wanted to accomplish shifted into finding a way to help our Eastern Kentucky family and friends that were recovering from the flood. As Angela and the rest of the foundation team searched to find a way to help our Eastern Kentucky family and friends, we knew that it was important to act not just with urgency, but also with compassion. We knew that we had to find a way to get them what they needed to get right back on their feet. We kicked off a fundraiser with the I Love Appalachia t-shirts, which was met with wonderful reception and an outpouring of support from all over the country. We were incredibly grateful, and that provided much needed funds to kick off our flood relief fund. After that, we knew that there was more that we needed to do, and we had our Greenbrier Golf Classic coming up, which had been a very successful event for many years prior to any of the full-time staff coming on board at the foundation. And we knew that this was an opportunity to earmark it for flood relief. Those funds also benefited Eastern Kentucky flood victims. But we knew, once again, we have to do more. We need to do more. And we partnered with Kendra Scott, who has a local Lexington store, and proceeds from the sales at the Lexington store as well as online helped to benefit our ARH Flood Relief Fund. By the end of 2022, thanks to generous donors from all over the country, and of course in our service regions, we had reached $2 million in donations. And it was thanks to the web presence and the ability to define and promote the need so that we could get what we needed for our donors to help our family and friends get back on their feet. Something else that came as a part of this relationship with long-term recovery groups was an idea that was born from an LTRG volunteer, which was the idea of Camp Noah. Something that is sometimes forgotten or sometimes just missed is the trauma that children experience when they go through natural disasters. As we go through the recovery process, there's so much going on, but we also wanted to make sure that we address the needs that the children have that experience this natural disaster. So we were able to sponsor Camp Noah, which is a camp that is specifically for children that have experienced trauma because of a natural disaster.
You know, looking back, some of the lessons learned, I think that, you can never be prepared truly for a situation like that, but some things prove more vital initially. For instance, the tetanus vaccines, hepatitis vaccines, insulin for people who needed it, first aid equipment. Those things you can sometimes keep on hand, but having access to vendors on a short notice who might be able to increase your supplies. So those contacts, oxygen, securing those tanks, those portable tanks on very, very short notice. So having those relationships with vendors to say, the what if. Obviously have on hand what you can, but some things aren't going to be good long term, they're perishable. But having those contacts with your community providers, your vendor contracts would be vital to preparation for something of this nature.
Lessons learned. One, start partnering with your state emergency management. Two, understand how the Emergency Operations Center works at the state level. We are a significant employer in Eastern Kentucky. We are the largest employer in Eastern Kentucky. We are significant corporation, we play a pivotal role. The State Emergency Management Agency recognized that we can provide the ground truth of what is happening because for the last 65 years, we have become part of Eastern Kentucky. So if they need information on what's happening in a specific area, they know that they can reach out to us. What we did was we developed a liaison position for the State Emergency Operations Center where we have an employee from ARH who is in the public health pod. And that gives them access to all the resources at the top level. So now instead of going through chain after chain after chain of different communities, we reach straight to the state level and we can get what we need immediately. Lesson number 2 is start learning about these NGOs, the non-governmental organizations. Understand that in a disaster like this, you have to recognize, and we quickly recognized, that this wasn't going to be a 30, 60, 90-day effort. It was going to be a prolonged, protracted, sustained commitment. And that's what ARH has done. We have committed to trying to help the people of Eastern Kentucky, our friends, our family, and our employees. And so we understand that the vast majority of your non-governmental organizations and government organizations are going to hit the ground running, and they're going to be there for 2, maybe 3 weeks. Once that hits, they're gone because they're moving to the next natural disaster. So what happens next? Figure out what happens next.
I think some of the lessons learned is consolidation of these governmental and non-governmental agencies coming together. We now have core community organized relief effort working inside of the Disaster Relief Center. We have Go Hire right next door. We have EK-SEP working out of our System Center in Hazard, Eastern Kentucky Concentrated Employment Program. I wish we would have done that quicker, and maybe we could have helped people sooner than we did. One other thing that probably would have helped us a little bit better is we had somebody inside the Kentucky Emergency Management Center relaying information back directly to our headquarters here in Lexington. It may have helped us a little bit better as well. So if this ever happens again, we have somebody inside the public health pod directly relaying information back to us here in Lexington.
Start wargaming it yourself. Think about how you would respond. Some of the things we did, we adopted from military tactics, strategy, and doctrine. Having the daily update brief so that you can turn this cycle of information over quicker, faster. Having a separate logistics supply chain that's co-located. Co-locating all the NGOs and GOs with our relief center was essential. It sped the cycle of operation for when our victims, rather than having to spend hours standing in line, driving across the counties to certain points to get one thing done, they were now able to show up at one specific location and accomplish all the tasks they needed to accomplish at one site and get supplies that they needed.
Reflecting on our 1-year anniversary events, we are so grateful for the support that we have received near and far for our ARH family and friends in Eastern Kentucky. But we always knew that this was going to be a long-term recovery process. And we know that the work is not done, but we are committed to standing beside and assisting with the recovery process, and we hope that you will be too.
I think it's a really impactful video, and I thank you guys, and I know you have a marketing team behind you too that helped with that video. Really captures the things you were going through in the moment. Go ahead and go to the next slide, Lynn. Yeah, there we go. So now it's time to do a little discussion, a little Q&A. So at this point, this is where we get a little bit of audience participation. Hopefully, Katie's monitoring the chat for your questions. And if one pops up, she's going to read that out so that our panelists can hear it. But I've got a couple that I have from watching your video and talking with you guys that I'd like
there
to
is
ask.
one in the chat. There's a question in the chat that says, "Thank you for sharing your experience and lessons learned. What changes did you make to your emergency preparedness plans as a result of this event outside of your new liaison position?"
Who wants to take that? I think Todd, you touched on it a little bit. Paul, you talked about the changes in staffing. Probably have some new planning partners at the table. Is that an accurate statement as a result of this?
Defer to Paul on that one. Paul, do you want to take that?
I think you're muted, Paul.
Lose Paul. Okay, well, while we try and get Paul back, and we'll circle back around to that question.
There's another question in the chat then, Tracy. Did you have spontaneous volunteers, and how did you credential them, such as background checks?
I'm feeling that's a Paul question too. Todd, can you help with that?
Yeah, I don't think we did any background checks on the volunteers. Our CEO was a huge part of the volunteer process. She has so many contacts in the community that she reached out to people that she knew. A lot of politicians, a lot of schools. We had a lot of high school football teams, basketball teams. We had college basketball teams come in and help out. So we didn't really, I don't think we had any kind of background checks on any of the volunteers.
From a communication perspective, this was our social developed really quickly because big pleas to the public to the distribution was out of and have them help organize and distribute supplies. So at least from the communications perspective, we really social media as an opportunity to recruit those volunteers.
I see a question about the role of the public health departments assisting post-flood. I will say that, there were a regular cadence of calls from the surrounding community health departments to assess needs, abilities, mobilize resources, and work with the state emergency management leadership in order to, prioritize certain needs and certain, aspects of the recovery. So they were very involved, and having worked firsthand with them, they were very helpful as well.
So there's a question about the presentation being shared with others. This presentation is being recorded and will be available online after. So there will be a link that you can review all of this. There's another question about going forward. Are you including volunteers in agency-specific EP?
Can you guys hear me yet?
Got you back, Paul.
Yep.
Yeah.
Great.
Can you say that again, Catherine? You broke off on my.
Yep. Going forward, are you including volunteers in agency-specific emergency preparedness training?
So,
if I could just ask, because I know this is a big part of the community that you guys live in, like registering volunteers, which we know is a best practice, is always a good idea. but I get the feeling from talking to you guys that the makeup of your community really is just going to lend itself to spontaneous volunteers. So do you think anything happened that would maybe help you better organize or better rally the troops more quickly to get things underway faster?
I think in hindsight, we do have our emergency preparedness plans for events that are on a much smaller magnitude. And I would go back to one of our hospitals in West Liberty, Kentucky, was directly hit by a tornado about 10 years ago. And so our response to that was on a much smaller scale, and we were able to respond very quickly and efficiently because there was an understanding of what we needed to do to get that up. So and this goes back to some of the questions everybody asked earlier. You have to understand that when we talk rural Kentucky, it's a very rough and rugged terrain. And so some of the issues are communications issues that we've run across. So what we've done is we've really put some investment in satellite technology. So now all of our hospitals have satellite phones. We were able to push satellite phones out to our employees doing field work so that we can maintain communications, because at best of times, we probably have, I'd say 70% coverage in Eastern Kentucky on cellular. And so part of, what we had to do was figure out a way to be able to communicate with our hospitals. So now when you look at what happened last year, it was such a increase in the magnitude of the event that the small scale plans were quickly overcome by events. And so when we look at registering volunteers, we went to known volunteers. We tapped resources where we were able to leverage the relationships we had with schools, colleges, universities, fraternities, sororities. And so we were able to fill that volunteer pool very quickly. We didn't really vet, the students and known members from our own communities, from our churches. We just accepted them in because at that point there was such a manpower need that, if we had stopped to try to vet everybody through a background check, it would have impeded the progress. When we were loading vehicles, police officers that were coming off shift would show up, and maybe 10 or 12 police officers that were coming off shift would just show up in uniform, help us load trucks, help us unload trucks. So when you think of like a traditional process for vetting, that's more in place now. And with what Todd is doing at the DRC, RDC, where we have programs with Go Hire and EKSEP, where we have vetted volunteers that are actually now in a paid program through the emergency funds that are available for natural disasters. So that's, once we made that turn from the public facing agency to the NGO geo facing agency, we were able to better vet volunteers at that point.
And Tracy, we still have volunteers. I manage our regional distribution center in Hazard. I manage about 15 employees, but I still have probably 4 or 5 volunteers, and I've reached out to them. Hey, I can pay you guys. I can hire you and pay you. And they're like, no, we're good. Just want to volunteer.
Also, I do remember quickly there was developed an online sign up for volunteers, whether it be internal from the organization or external community, and whoever was in charge of a particular area, whether it be the distribution center or the supply or internal, there was an ability to kind of gather those names that had volunteered and then distribute those where the highest needs were. So there was some track of that as well.
We maintained a list of the volunteers, from when we started our call for volunteers. That list was maintained and checked off daily, but there was no, background check where, it would take any time of lengthy process. The cycle that had to turn over was so quick that there was no in-depth background investigation done on the volunteers.
Thank you for that. Another question is, I am assuming you had a disaster plan. Due to the enormity of the situation, in what way have you improved your disaster process, i.e. quarterly disaster runs to practice? If written, can you share with others?
So each hospital now participates in the quarterly state programs. Each hospital has an individual disaster plan that goes into effect in these circumstances. It's not one master plan because each one has its own unique geographic idiosyncrasies. And so we're 14 hospitals spread across 2 states. So Southwest, West Virginia, and then Eastern Kentucky, pretty much down to the Tennessee border. When you look at that, no one hospital is the same. And then when you add in the 100 or so clinics and pharmacies, each one has its own almost individual plan. Does that make sense to everybody?
Yeah, that makes a lot of sense.
And then now, and with having that liaison with the Kentucky Emergency Management, that's going to help significantly.
If I could ask a question right here, Katie, before we move on to the next one in chat. Todd, how long did it take? Because, you know, there's that initial response and it takes a while before things get a battle rhythm, so to speak. So how long did it take from go to get that coordination with emergency management and public health in your emergency operations center at the state level?
Yeah, Tracy, that was immediate response. The thing with Paul and I coming into ARH is, in our past life of law enforcement, we had those contacts with emergency management because the director of the emergency management for the state of Kentucky was a state police captain. So we worked with him. So we just picked the phone up and called him up and started working together.
I know,
and that was Paul doing that, obviously.
Yeah, I know you guys have some unique contacts, so you leverage some relationships that not everyone has access to from the get-go.
Yeah,
rather than doing the usual local, state, federal. Yeah, you guys had a different approach to this event.
100%. We had all those local, state, federal contacts, so it was pretty easy for Paul to do that.
Another question in chat is, what transportation support services were provided to the home care team who made their home visits?
I'll jump in there. Initially on that, first few days after we had access to it, a lot of personal vehicle use was utilized. Some of the personal ATVs, as I mentioned, were used. I had mine out there. I even heard of some home health workers on horseback getting up to places they couldn't get to. So whatever was available, there wasn't really a coordinated transportation system. This isn't, something that the communities would have. And so internally, other than personal use, I'm not aware of any organized transportation system otherwise.
What was
and I'd say, go ahead.
I'm sorry, Paul, what was the EMS capability in the area to get to, 911 calls and for transport to hospital facilities?
Well, I'll jump into the county EMS systems, with the availability that they were stretched pretty thin, as you can imagine, the number of trucks available on the road, all hands were on deck. So, all of their buggies were mobilized that they could staff. Also keep in mind too, the National Guard did provide some assistance in some of that when necessary. And I don't know how many runs they would have made in that particular arena, but they were available. But otherwise, it was everything that we had available. But keep in mind, there's not some of the counties have very limited EMS, availability in terms of the number of trucks available. Larger county systems were very, very active and were expanding what they could when needed.
And I think the hardest thing for everybody when you're looking about this to grasp is, and that's a great question, but one of the things that we had to deal with was the lack of communication, and the lack of the general population to communicate and actually move. And so it took us a long time to have accountability for all our employees in excess of a week because people were landlocked. The floodwaters didn't recede for a while. And so in some areas, EMS, wasn't able to get through to places. Like Dr. Harrison said, in areas where you couldn't reach by vehicle, supplies were brought in by horse. If you couldn't get there by horse, they're brought in, foot mobile people that would literally friends we know put 60 pounds on their back and just physically carried it out there 3 or 4 miles to get the essential needs to the people that were trapped. Infrastructure, was destroyed in some areas totally. And so a lot of our areas, there's not a lot of flat land. And so access to flat land comes from culverts that are bridged. And so those were wiped out. And so now vehicle traffic was very limited, like Dr. Harrison said, to four-wheel drives, side-by-sides, ATVs, horseback. And so EMS faced those same issues. And so, everybody tried to support the efforts they could, but access was really difficult in some areas.
Thank you. Another question, did anyone do a community assessment for public health response or CASPER? And if so, what were the top needs for those affected by the flooding? Flooding is one of our top hazards in my area, so just curious to help be prepared in case we get hit hard.
I'm thinking that's a Dr. Harrison question.
So related to so say that again in terms of the community assessment needs?
Yeah, so the CASPER, they just said what were your top needs for those affected by the flooding?
I'd have to go. I'm not quite sure off the top of my head, the top 3 list per se, but initially when you think about it, it was, the initial response was different than the follow-up, planning. So I don't know. I think checking in with our health departments and all that, I'm not quite sure the answer to that, to be honest with you, in terms of the top needs that were listed from there.
I could tell you though, if you have an event like this that's on the scale and magnitude of this, the essentials that everybody needs immediately are food and water. And within using our contacts, within, I want to say 36 hours, we had probably, Todd and I were looking at the numbers yesterday. I want to say 60 tons of food and water at our regional medical centers within 36 hours. That was broken down, distributed to our critical access hospitals. We then broke it down and pushed it out to the clinics so that it was getting to the people that needed it the most. We were able to use our internal supply chain to push out things that were desperately needed because a lot of the towns that were flooded had their water sources compromised. And so fresh, clean water for everybody was top on the list, followed by food. And so when you compare that to like our West Liberty tornado, you don't have that same magnitude of need in the community. And so when you look at something that's an event this size, that so many people were isolated, like Dr. Harrison said, National Guard was flying in areas that they could see were obviously landlocked, and they were making aerial delivery for food and water for people. We were pushing out, and when you put it in perspective, you're looking at July, August timeframe, the hottest parts of our summer, where you've got high humidity in this area now, high temperatures, dehydration, and access to water was compromised across that entire area. And so I'd say your top needs are going to be your essential life needs is, water first, followed by food, followed by shelter. And that's something that we quickly recognized was the need for shelter. And we were pushing out all the types of shelters we could. You don't think about it, but when you lose everything, where do you go? We have limited hotels in Eastern Kentucky, so those were immediately filled up. Available housing, well, it's completely not available because it was either destroyed or it's immediately filled. And so a year later, we still have people living in temporary shelters, as in tents, pop-ups, campers, meeting that need to rebuild in our section of the country is challenging due to geography. And so I think the top three essentials that if you assess that, you need to think about how we're gonna, supply, water to everybody, food to everybody, and then shelter them from the elements. Two of our hospitals, because of infrastructure damage during the floods, needed, emergency water sources. And so, we leveraged, from my work in the Marines, I knew how humanitarian assistance worked. We were able to leverage water purification systems to provide, a clean source of water to our hospitals. We were down to 24 hours of water at our regional medical center when we had the system installed that provided the water that was essential to run the hospitals for the next 90 days. And so we did that at 2 different hospitals. So recognizing what your needs are, looking at your hospitals and looking at the infrastructure going like, well, how do we run our hospital without water? What services are dependent on water? I mean, if you don't have water, you don't have surgeries because you can't sterilize instruments. Everything, when you think about it, is so dependent on that infrastructure that supports the hospital. And so had we not developed that plan to make sure that we had a constant source of water to support our hospitals, if Dr. Harrison, if we didn't have water at our hospitals, what treatment could we have offered?
Very little. And like I said, I wasn't sure what the CASPER results yielded on that after the fact. But, to his point, looking at it, what are the emergency provisions, to get those supplies to people? What's your plan when communications are down for your community? And then what's your plan for distributing the supplies that you can get? I mean, that's kind of my personal, follow-up to the community assessment needs. But without those emergency water supplies, I mean, nothing happens really or safely at least. So, that's priority number 1 in most situations: power and water. That's acceptable.
I know that we're right up against the 12 o'clock hour, and I really don't want to interrupt because I do see another question in the chat, and then I have a question for Whitney, and we still have the vast majority of our participants with us. So I'd like to go on for just a few minutes longer. So Katie, if you want to take that question there, I believe Scott would probably be on deck to answer that one.
So the next question is, what needs to be considered in coordinating such an initiative now when essentially everyone has been impacted? Consider this may not be on the radar for others. So I'm kind of assuming the question is, since every person was affected, how did you kind of coordinate everything, and how are you kind of putting that into your plans now?
I think specifically you guys talked about the support you provided your employees, because so much of the community is actually employed by ARH. Did you support them so that they could in turn then come and help support the rest of the community?
You got that one, Dr. Harrison, or you want me to grab it?
Go ahead.
So when you're talking about how we supported it, you have to recognize that the vast majority of our workforce was impacted by this. And so it's a I don't want to say it's a cultural thing, but it is a cultural thing in Eastern Kentucky. It's very close-knit, tight communities. And so those that were less impacted or more fortunate stepped up and covered for those employees that couldn't. We changed our model of how we do things as far as supporting our employees. Cafeterias were open 24/7. Food was available for everybody. Pushing it out because you have to realize gas was in short supply in the first 2 weeks. We had a Ford area. We had the government was state agencies were pushing back Ford fueling points for us. They were making sure all the infrastructure is there to support it. All the support came from outside the impacted area. So when you start thinking about it, you have to think outside the box and go, let's not look what the local people right there can do. Who's going to push? So we had our hospitals in West Virginia pushing supplies to Eastern Kentucky. Not only were they pushing supplies, they were preparing meals that would be pushed out to support the employees that are at the hospitals working. Extended shifts were created. There were volunteer lines or volunteer sign-up sheets where those working could go, they would volunteer their time at the distribution centers. So they'd come off working their shift, then go work in the distribution center because it was a collective community effort. And so there was a sense of community that everybody knew they had to help everybody else.
Thank you. And Tracy, I see a lot of people having to drop off. So if you don't mind, why don't we go to the next slide and then we can answer some more questions too, just to make sure people get their CEUs as well.
So here's the contact information for all of our speakers. And you can always reach out to Katie or myself. And we can get you linked up to the speakers for today. And then next slide, Lynn.
So as Tracy mentioned, there is CEU credits available for this presentation. You can scan or click the link when this is posted. You do have a couple-day window to click the link, but again, if you want to take out your phone and scan that QR code, it'll take you to a list of a couple questions you will need to answer, and then you should receive your certificate after. But thank you again for everybody that was able to attend, and we'll answer, I believe, Tracy, a couple more of the questions that are here in chat if you can stay on.
The first question I have is for Whitney, because I know a major challenge in an event of any scope, but particularly in one the size of Rhode Island, is messaging. So how did your organization, the ARH Foundation, and your 2-day into her job new head of that organization, what was the partnership like with ARH and with the local media so that you got the supplies you needed in form of donations, so that, you weren't getting prom dresses and those kind of things?
It is a challenge, and so the communications team at ARH really partnered with Paul and his team to make sure that they were a part of what was happening on the ground so that they knew the most up-to-date needs, because in a natural disaster, those needs change quickly. And so the messaging had to be current and up-to-date so that we weren't getting, like you said, things that we didn't need at the time, and that we were able to meet those most critical needs. Having a partnership with media, and I say partnership because they were covering the situation, they were covering the gravity of the situation, but they became a partner when they started sharing the need and making sure that we were able to meet the needs of everyone. And still a great partner, because a year out, we are still very much working to meet the needs of flood victims. Just as Paul said, there are still people with temporary housing, temporary shelters. The need is still there, and we are committed to meeting those needs. So now my messaging is really being intentional, and I'm trying to communicate that while we're a year out, we're still working to help those flood victims. It's not over yet. It is a long-term effort. And I communicate very frequently with the long-term recovery groups to make sure that we get funding and we get, things that are at the disaster relief center, washers, dryers,
mattresses, anything you can think of, to the people that need it most, and that we're able to meet those needs. So our partnerships with the governor's office were also critical in making sure we were getting this message out to as many possible people as we could.
Great. And with that, we're at 12:05. If you had a question that didn't get answered, feel free to use that email address for myself or Katie. We can get you the answer you seek. If you come up with a question later on after viewing this, certainly use the same mode to get a hold of us. Katie's going to put in the chat a link to a publication that ARH put together to commemorate the 1-year anniversary of this event, and then the ongoing efforts in the community. There's a lot more information in there about some of the intricacies of this response that we just couldn't have covered in a 1-hour webinar. So with that, I thank our panelists very, very much for the months of planning that went into this, and then for joining us this morning. And I thank everyone across all of our partner agencies this morning to hear this incredible story. I think we're going to sign off.
Bye, guys.
Bye.